Here we're attempting to do three things. First of all, we're aiming to be one of the first interdisciplinary training clinics in Ontario. So that means we have psychology, both clinical and applied school psychology, and we have speech language pathology currently. And then we'll have autism services in the future and social work in the future as well from King's University College. And secondly, we're aiming to be cost reduced for families. So a lot of services within the community are either free, but there is a very extensive wait list, years and years, or they're pay for service, but they're much more expensive than most families can afford. So we are offering a sliding scale so that we can come at those sort of needs that families have around financial barriers. And then lastly, we're aiming to do very high quality research here to determine what the best practices are in working with families in an interdisciplinary team and bring what we've learned from the clinic to the community to further understand what is going on with children and how we can best help them in those ways. And we know that about 1 in 4 to 1 in 5 children and youth will have a mental health disability in the City of London, but we also know that among those who have mental health illness, that only about 1 in 4 of those will seek help. And that is because of these many barriers that we see, financial barriers, getting to treatment.
Again, from a clinical perspective, to have that rich data set of clinical information and assessment data, which is standardized, that they can use as part of their work and lab projects that way. So this is, we don't know of any other clinics that are capturing this data in a way that such a vast network of researchers could use.